Hey guys, welcome to the AAFE Med Spa. We are doing some trigger point therapy today. What I am starting off by doing is assessing to see where those trigger points actually are. So I usually start on the left or right side of the trap first, and I am isolating with my thumb and a little bit of pressure where that trigger point is. So I'm usually applying pressure for 6 to 10 seconds to kind of see if that pain is referring. If that pain is referring, it's a true trigger point. If that pain is localized, it is myalgia. So just keep that in mind when you're assessing your patient. Once I figure out where that trigger point is, I isolate that muscle with my left hand. So I'm really making sure I'm pinching up on that tissue. And then with my dominant hand, I have a cocktail of Botox and lidocaine in that syringe mixed together. So I go into that tissue that is pinched up. I push a little bit of that product because that lidocaine is going to numb that area. I count to 10 in my head and then I start needling back and forth. You want to needle pretty quickly. You want to make sure that your depth is no more than 3/4 needle depth and that you're always parallel with the floor. Just in case you were to go through the other side of the tissue, you're going out towards air and never down towards lung. So always keep that in mind. Always make sure you're really isolating that muscle so you are working in that muscle and you have a thick area of tissue that you're treating and you're not putting your patient at risk with a pneumothorax. So as I'm working my way through the tissue, I'm really making sure that if I'm feeling any tension or any type of styrofoam feeling, I'm pushing a little bit more of that lidocaine and Botox to break up that adhesion. So really needling, I usually typically stay in that area for 30 to 60 seconds, and then I like to come out. This patient has some severe TMJ symptoms, so I really spent my time in here working on that tissue until it was smooth, and then I came out with my needle. So overall, just kind of do what's best for your patient based off of assessment, kind of figure out what's best for them and how you're going to approach their pain. But once that's done, I typically reassess the other side. Again, here, as you can see, I'm pushing down and I'm applying pressure so that is blanching. My fingernail typically leaves a mark in the patient. You want to be applying a good amount of pressure here. A lot of the times when you're assessing a patient and they're not feeling pain, it's typically because you're not applying enough pressure or it's not a true trigger point. So just keep that in mind. We're repeating the same process on the other side. As you can see, I have that muscle isolated and tented up. I am pushing a little lidocaine at the beginning of that insertion just to kind of numb that area. While I'm having that tissue tented, I'm working that needle in and out of the tissue, being mindful that I'm not utilizing more than 3/4 of that needle depth. I don't want to be hubbing that needle. It is a longer needle. We do not want to put the patient at risk at all. So overall, I'm really making sure that I am being a safe injector here, keeping my needle parallel with the floor, and kind of targeting exactly where that tension is. So if I'm feeling any type of texture in the tissue or just tension, I'm really trying to work on that muscle and break up that adhesion. So really focus in on that. Communicate with your patient during this procedure. If they're feeling lightheaded at all or if they just need a break, just make sure that you're communicating with them, asking them if they're feeling okay, if they're feeling pain. If they are feeling pain, you might need to sprinkle a little bit more lidocaine in that area before you continue needling. So overall, just really use your assessment skills as a provider, communicate with your patient, and really focus in on those safe injection techniques. So again, making sure you're parallel with the floor, making sure that you're only using 3/4 of your needle depth, and really making sure that you're not going to poke through the tissue on the other side or you're not angling that needle down. But overall, this creates a really good therapy for our patient, gives them short-term relief with the lidocaine and then long-term relief with the Botox. So overall, I think it's something great that you could be incorporating in your practice. Make sure you educate your patient that they can be sore after the procedure. Thanks for coming along.